Good morning, everyone. Welcome to this fifth webinar on the global indoor air quality and respiratory infection. My name is Prashant Kumar, and I'm a professor and chair in air quality and health. We have got two of our colleagues, the speakers from China and Tanzania, so you will hear today from them. But before we go further, just to give a very brief, the background of these seminars. So this is a the seminar which is taking the legacy of the GCARE, the projects, where we have the 12 different countries from the different continents are involved in there. So this project is called the Knowledge Transfer and Practical Application of Research on Indoor Air Quality. So we call it KTP-IAQ. So it aims to build a exchange platform across the ODA countries with an aim to share and discuss the the best practices on indoor air quality and respiratory infection. So there are 13 cities involved with over 40 researchers coming through these different groups at different levels, including the masters, the postdoctoral researchers, including lecturers, senior lecturers, readers, and at professor level. So as I said, this is a these are the countries you can see on the screen. So they come from these different regions. That includes Latin America, where we have Brazil and Colombia. Middle East, where we have Egypt and Kurdistan, Iraq. We got Southeast Asia, where we have a number of these countries, including China, India, Bangladesh, and in Africa. So we got the 5 countries involved in there as well. So it is, as I said, is the legacy of the project which we started. We call it Clean Air Engineering for Cities, Care Cities. So the idea of this work was to look into the exposure inside cars. So we had done some interesting studies across all these countries to to measure the exposure inside cars and to estimate the health risk and come up with the recommendations that can help reduce the exposure to the car users in these countries. And then it was followed up by another project, which we call it Clean Air Engineering for Homes. So this is for care homes. And that project ended last year. So we are working on exploiting this data set. So this is one of the papers which was submitted early this year. And we are still kind of working on this. So this was a 7 the talks in this webinar. So today you will hear from 2 of the colleagues, and the next one is going to be on 18th of February. And colleagues coming from Egypt and Kurdistan. So I think with that, I would like to invite my colleague, Professor Graham Miller. So he's a Pro-Vice Chancellor and Executive Dean of the Faculty of Arts and Social Sciences at the University of Surrey, and takes Penn University Leadership for Sustainability and Employability. But before I pass it on to him, just 2 key things to mention here. The one is the Q&A, the box you can see on your screen. So please add any questions you have on the speaker's talk in the Q&A in the box. I will pick those questions and read out to our speakers towards the end. If you want to be named, you can put your name against your question and the location, so that I can mention that while I'm picking up your question. And the second thing is that this webinar is being recorded. So we will put that onto our the YouTube channel along with the other the 4 webinars which are already there, in case if you wanted to refer back or you wanted to share with your colleagues. So with this, it's a great pleasure to invite Professor Graham Miller to open this webinar.
Thank you very much, Prashant. And on behalf of the University of Surrey, I'm delighted to welcome everyone to this, the fifth in this webinar series on global indoor air quality and respiratory infection. So this is a monthly webinar series. It's EPSRC funded, as well as being supported by the University of Surrey. And we are very pleased to support this important area of research and the excellent research that it produces. I have the privilege and responsibility of leading sustainability for the university. It's something that we take very seriously at the university. We were only the second university in the country to develop a net carbon zero plan by 2030. The University of Cambridge beat us, I'm afraid, to be the first one, but they had a 400-year head start on us as a university. So we were the second university in the country to make that ambitious commitment, and we now see over 40 universities in the country have made a net carbon zero commitment. We have committed to integrating sustainability into all of our undergraduate degrees. So whether you're studying maths or music, students will have an understanding of sustainability and how in their lives, as their personal lives, as well as their professional lives, they'll be able to take the actions and have the understanding of the impact that their decisions have on sustainability. We're launching a new degree in sustainability, undergraduate degree in sustainability next year. That will be an interdisciplinary degree that stretches across health, it stretches across engineering, and my faculty in arts, humanities and social sciences as well. And we'll be launching an Institute of Sustainability early this year, which really seeks to harness all the research across the university in sustainability. So this is something we're very committed to, and Prashant's group takes a leading role in that work on sustainability. So I'm delighted to be able to welcome two excellent speakers today. We're going to take the two speakers in order. So I'll introduce the first speaker first, and then the second speaker after the first speaker. So the first speaker is Professor Shi-Jie Cao. Professor Cao is a full professor at the School of Architecture, Southeast University in China. He is a visiting professor here at the University of Surrey in the Global Centre for Clean Air Research. His research interests are about air quality prediction and control, sustainability for urban environment and design. He's the president of the International Society for the Built Environment and serves as a deputy editor for the International Journal of Indoor and Built Environment, and is on the editorial board of Sustainable Cities Society Safety Science. So I'm delighted to welcome Professor Cao to speak. And with that, I will hand to you, Shi-Jie.
Yeah. So, thank you so much, Professor Miller. I will share my screen. Can you see my screen? I will use presentation mode. Okay, thank you so much. First, thank you, Professor Prashant Kumar, and invited me to give a presentation regarding mitigating strategies of COVID-19 infection indoors. Two methods of mitigation strategies. One's about smart ventilation, another one's disinfection. I'm from School of Architecture, Southeast University. The presentation outline includes 3 parts: background, methods, and 5 cases. So I think I need to hide this. Yeah, presentation. Yeah. So my presentation includes mostly several researchers work. It's basically my team. So it's kind of a combination of different application cases. So I'm going to skip the background of pandemic situation. So it's severe globally. The possible transmission pathway of COVID-19 includes 3 different ways, mainly. The ones, contact transmission, droplet transmission, and airborne transmission. Yeah, exhaled droplets may fall down and contaminate the surface. So its effective can last for a few hours to a few days. So air disinfection is very important, and also ventilation to bring the fresh air to remove this virus is also very important. Virus can re-enter the air upon the surface disturbances, especially in public buildings, because of it's very crowded, so human density is very high, so infection chance is a lot higher. COVID-19 virus is kind of indoor air pollutant sources. So when we control COVID-19, reduce the infection risk, actually it's kind of control indoor air pollutant source. Let's recall briefly about the methods of indoor air pollution control. There are 3 different methods: one, source control, and purification control, and ventilation, and air ventilation, and using airflow to remove, to dilute indoor air pollutant. Because of the source, most of the time it's uncertain. Like infected person, we don't know, or where are they and how many people are there, so we don't know. So when we need to use ventilation, either natural ventilation or mechanical ventilation, especially when we in outdoor. So because of the large ventilation rates, natural ventilation rates, so it's kind of safe. So indoors we have to use either wearing mask or use large ventilation rate. So another method is about air cleaning. So we, because of ventilation, so we have to generate kind of well-designed airflow, so to remove indoor pollutants. So air cleaning is also very important. Either we can use a filter, a fibrous filter, an electrostatic precipitator, and also HEFS, hybrid electrostatic filtration system. Also, UV is also very important to kill the virus. UV and HEPA, the combination can be, the performance can be very high. So I'm going to skip the principle and the methodology. I show the result. We can see the combination of UV and HEPA, the remove efficiency can reach, if we well design the remove efficiency can reach to 100%. So ventilation is it's very important methods to control indoor pollutant or to reduce indoor infection risk. The essential function of ventilation is to remove the indoor pollutants by inducing the fresh, clean air to create a healthy and energy efficient indoor environment. Basically, we need to well-organized, well-designed airflow pattern to remove indoor pollutant. Because the pollutant source is kind of dynamic, and also the distribution is not uniform. So we need to try to use smart ventilation control system to satisfy the dynamic requirement of removing indoor pollution. Or why it's important? Because when indoor airflow pattern, if we induce indoor airflow pattern to the particles or other pollutants can go along with fresh air, but the direction is very important. So we have to keep people healthy, not let the polluted air enter into people's face, healthy people's mouth. For dense crowded indoor environment, for instance, in train station, shopping mall, ventilation rate should be increased to reduce infection risk. The indoor airflow rate is normally not sufficient to control the infection risk. So mechanical ventilation is generally recommended to improve the ventilation rate. For the designed rate of a public buildings, it's 30 cubic meter per hour and per person. But now it has to be increased at least 7 or 8 times to satisfy the healthy indoor environment. However, higher ventilation rates would result in either higher energy consumption and thermal discomfort. So low-cost design for ventilation system and also smart control ventilation is recommended. It's also main part of this presentation. So I'm going to provide 5 scenario case studies of indoor environment based on offices, classrooms, and the international exhibition center, which is large size buildings. The first one is office. It's our students' office. It's full of students. So we try to reduce the infection risk. First of all, we try to analyze the indoor airflow in an indoor airflow pattern of mechanical ventilation system to ensure the air distribution for each person is normally uniform. So we need to redesign the ventilation system. And besides that, we also try to use a physical barrier to reduce infection risk. So, but how to design, design the physical barrier, the height, how much is the height? So that's the main concern of this research. So let's look at the without barrier. We can see the infected virus can spread into the lots of region of the room. But when we install the physical barrier, also when we increase the height of barrier, the virus can be isolated into around the region of the infected persons. So especially when we increase the height from to 60 centimeters, the removal efficiency is largely improved. Let's look at the next slide. So we presume there are 3 different infected sources, A, B, C. So when we increase the height of the physical barrier, we can see the infection risk is largely reduced. The conclusion is that we need to provide sufficient ventilation. Also, the height of the physical barrier should be larger or higher than 60 centimeters. People should sit within 4 centimeters from the ventilation outlets. This is also important, the location of ventilation outlets. The second one is the classroom. In China, I think over 95% of classrooms, we don't have mechanical ventilation. Most of the time, it's relying on natural ventilation, especially in spring, autumn, we can open the window. But we try to design the window openings to get the induced natural ventilation airflow patterns. And then we found it's still not sufficient to reduce the infection risk. Then we try to use low cost strategy by installing the fan inside the window. So first of all, we try to design the window locations, the size, and also the doors. We found the cross ventilation is a lot better compared to other design modes. So infection risk can be decreased by 27%. So now let's look at the combination of window opening and the fan using. So before we're using the fan, but only by optimizing the windows design, the infection risk can be decreased by 25%. If we're using fans, the infection risk can be decreased by 48% to achieve the better removal efficiency. The next one, we are trying to use disinfector, also air cleaning system. So now we try to use negative ions, this kind of disinfector to kill the virus inside the classroom. It's also kind of low cost compared to mechanical ventilation system. But now the question is that how many air generator or disinfectors should be installed? Where should we install, and how many numbers should be there in the classroom? That's our main focus. So let's look at the ion distribution inside the room with different numbers of disinfectors. We can see as we increase the numbers of disinfectors, the distribution is well distributed inside the room. Let's look at the result. The disinfection effect was largely improved as we increased the number of IO generator 4 or 5 for one typical classrooms. So we generally need one disinfector in our case for 30 square meters. The maximal disinfection efficiency was around 80% in our current case. The infection risk can be greatly reduced by 24%. Next case studies for public buildings, we're trying to use smart ventilation system. Because we can't increase the ventilation rates very to provide an adequate ventilation system because of energy conservation, also the noise control. So now we try to use this kind of smart way by using camera surveillance to monitor the human density and to provide sufficient ventilation for the demanded zone. So with the I don't know what yeah, you can see. For if the human density is higher in certain zone, we can specifically provide sufficient ventilation rates in that particular region to save energy, also to reduce the infection risk. So in our controller, so there are two requirements. One's ventilation rate should be based on standard for that particular region. Another one is based on this kind of Wells relay model. It's kind of infection risk prediction model. To look at, yeah. So first of all, camera should be installed. Surveillance camera should be installed. Also, the ventilator for particular region can be controlled by our controller. So let's look at the result. The yellow is image recognition methods to predict occupant density. The accuracy should be around 92%. So by using this kind of methods, the infection possibility can be controlled within 2%. And also we can save energy by around 10%, 11.7%. The last case is for a larger building. This is International Conference Center located in Nanjing. It's 190,000 square meters. So we try to provide this kind of intelligent monitoring and online and control system, ventilation system, to ensure to reduce the infection risk, ensure the health and safety. To build this kind of a smart ventilation system for large size buildings, there are two methods. One is our fast prediction methods by monitor the CO2 concentration. Also, we self-developed this kind of online control system. Inside the public building, disinfectors are installed in both inside the room, also along the outlet and inlets of ventilation systems. We also developed this kind of different types of disinfectors and smart ventilation systems to control the indoor environment quality and reduce infection risk. So there's a short video, maybe it's more clear.
just to say that I don't think the sound is coming, but I think I can see the visuals.
The video is based on the real project of that for that International Exhibition Center. There are two main novelty points. One is we can predict indoor CO2 concentration based on the three different monitoring points. And another one is using the camera, surveillance camera to predict the human density. And then we can use our smart control system to provide sufficient ventilation for the demanding zone. So this is a result of the disinfector, the owned negative own distribution inside the room. We can see if we increase the sufficient number, so the infection risk can be reached can be reduced, largely reduced. So this is the result conclusion based on this project. So based on this intelligent ventilation and disinfection system, the risk of human infection can be controlled to within 4%. Also, the energy conservation can be achieved. So these are references of this work. So I'm going to acknowledge to our team, Mr. Ren Chen and his PhD candidate, also Ding Junwei, and another PhD student, Zhu Haochen, also Dr. Feng and Dr. Wang. Also, I'm very grateful to Professor Haggett from Concordia University. Of course, Prashant Kumar is also a very important collaborator to get this research work. Also, from NSFC's funding support. The last is kind of promotion. So our handbook of ventilation technology is just launched 2 days ago. So thank you so much.
Thank you very much, Professor Cowell. That was fantastic. And what we're going to do is hold questions on that presentation.
Okay.
And we're going to come to our next speaker, and then we'll take all the questions at the end. And Prashant will chair that section. So if we can change over the slides, our next speaker is Dr. Vera Ngowi. She's a retired senior lecturer, lucky her, at the School of Public Health and Social Sciences, Muhimbili University of Health and Allied Sciences in Dar-es-Salam in Tanzania. She holds a PhD in epidemiology from the University of Tampere from 2002. She joined academia from the Tropical Pesticides Research Institute in 2007 and became head of Department of Environmental and Occupational Health from 2009 to 2012. She participated in the KARE Cities, so Clean Air Engineering for Cities project, since 2019 as a collaborating partner, and is also part of the team that implemented care homes that we've heard about already from Professor Kumar. So Dr. Ngowi, are you ready to present? In which case I will hand over to you.
Thank you very much for your introduction.
That's it. If you can put that on presenter view, then we'll be able to see them in full screen. Okay. That's it. Perfect. You're all good.
Thank you. Thank you very much for the nice introduction. And I would like to start by saying that I'm very thankful to Professor Prashant for involving me in the care projects, especially care cities and care homes. And initially, when he invited me to join the team talking about air pollution, I just felt it was out of place for me. And I was telling him that I could find somebody who is better conversed in air pollution than myself. But they said, oh, let's give it a try, and then we'll see later if we need to substitute. But then my specialty is looking at chemicals exposure and their health impact, particularly pesticides. And whenever we look at exposure, we are thinking about exposure through skin, through looking at the way people apply the pesticides, maybe through eating and all this. The air exposure is overlooked when we look at exposures to pesticides. But after participating in this project and reading through, then I realized that actually, now I know better that we need to know a lot more about air pollution and how chemicals, particularly pesticides, contribute to ill health. So today I'm going to present to you the current status and challenges of indoor quality monitoring in Dar-es-Salaam, just as a layperson, in a way, having participated in these two projects, but maybe in the future, I'll be able to do better. My main points, I'm going to talk about Dar-es-Salaam city itself, describe it. I know many of you know it, but it will be good to remind ourselves where we are, and then look at air quality monitoring and the challenges that we are facing, and give a summary. So Dar-es-Salaam city is the largest city in East Africa, according to analysis of people, and then it is an industrial city and a major port for Tanzania. It has a high concentration of trade, different types of trade and other services, and there's a lot of manufacturing going on around Dar-es-Salaam and the neighborhoods compared to other parts of the country. The population of Dar-es-Salaam is estimated at 6 million, and majority of the people live in informal settlement. And this population of 6 million is mostly maybe during the evenings or at night, but during the day, they say that we could reach up to 9 to 10 million because of the people coming from the neighboring region and districts. When we talk of air quality now, air quality monitoring, air quality, especially indoors, we are mostly concerned about concentration of pollutant, which you are going to see the major ones later. And we are concerned about the heat, especially for places like Dar-es-Salaam, the temperatures and humidity. These conditions, they affect our health, our comfort, and in turn, our performance. If we are not in good health, we are not comfortable, it means even people who are staying inside, they cannot perform properly. Unfortunately, in Tanzania, we don't have data, don't have reliable data, so to say, because Tanzania does not have air quality monitoring programs, especially in the air quality. And to me, I think the cost of indoor air pollution monitoring and control, considering the pollutants and the different parameters that need to be taken into control, the costs are too high for our government. The key pollutant, the key sources and pollutants of air in Dar-es-Salaam specifically, although it doesn't differ from other areas, we have different sources and different pollutants. We have the major ones, was residences, either residences, the home, or residence, even in, I consider even hospitals and all these places as residences where people stay for a long period of time. And workplaces or schools, we have recreation and we have commuting transport, where people are moving either in public or in private transport. And the main pollutants are like particulate matters, their gases, carbon monoxide, carbon dioxide, nitrogen oxides. We have sulfur dioxides and volatile organic compounds. And for us specifically, we have pesticides for vector and vermin control, and we have cleaning agents. And looking at where they affect us most in residences and in work and commuting, you find that most of us will be exposed in all these areas. We'll be at home, we'll be going to work, and then we'll be in public transport. So we get affected. Like I said before, the challenges that we're facing were very limited initiatives that have been undertaken by the relevant ministries and agencies to address indoor air pollution. We have some guidelines on smoking where people are not allowed to smoke in public. That is the major thing that I see that is looking into pollution, indoor air pollution. So we are restricted. You cannot smoke on buses, you cannot smoke in public places and all this. But we need to do a lot more, but we need data. Unless we know the situation, we know what is going on, it will be very difficult for us to implement any prevention. So we have people who are taking interest in trying to do some research, and these are academic and research institutions. And for these people, they are doing research because maybe it's a prerequisite which is required for students to complete their studies, or it's because there's a need that has come, like where people want to develop technology, especially the cooking technology, and they want to know the situation, like assessing the impact of biomass pollution. So we have some of these researches that have been done and a lot more. And these studies, they're, like I said, it depends on the interests of the groups. We have had interest in in-car air pollution and in kitchens that we have participated in from the University of Surrey. And we have other studies that have produced results which I found interesting, like the one that is talking about having particulate matter concentration in kitchens, which are very high, extremely high in Tanzania. So these kind of studies, we are expecting them to feed into policies and legal frameworks so that action can be taken. But we don't have the right policies and regulatory frameworks in Tanzania on indoor pollution control, especially for public health and development purposes. We have some mentions of air pollution in like the National Health Policy, which identifies air pollution as a priority policy issue. But when you look at the health sector strategic plan that is trying to implement this policy, we don't see any action on air pollution control. And when you look like, for example, the Environment Management Act, it's trying to promote suitable technologies for the minimization of air pollution, but then they don't provide the suitable technologies, and they don't have means of trying to identify these technologies so that at least they can promote them. So priority given to air pollution, whether indoor or outdoor in Tanzania, is very low. And there is a gap in scientific data, which is critical for developing policy and actions to improve air quality. And to conduct air quality monitoring, as far as I'm concerned, there are too many parameters to consider, like the ones that we've seen for monitoring, particularly indoor. And we have a problem of our education system, especially higher learning, where we normally concentrate on theory more than practice. And we produce graduates who are not skilled in air quality monitoring. So when they go out, they not really go into air quality monitoring, but they'll try to control the pollution that is visible, that they can see. They try to control dust where they see dust, like in factories, and they try to propose maybe in some kitchens, like open kitchens where there's a lot of smoke, that is where they'll promote, they'll try to suggest things to do. But it's not because they don't want to work, but it's because they don't have the skills to control air quality. And then we have a problem of poor culture. I would say it's poor culture because based on division of labor and the way things are organized, you find that women and children are the ones who suffer most when it comes to air pollution, both indoors and outdoor. They spend a lot of time inside houses and kitchens cooking, and they spend a lot of time in the fields, which is outdoor. But when you look at the decision-making systems, you don't see many women in this system, in this decision-making in any organization. Most of the people who make decisions are men. So it is very easy for them to overlook the plight of women. And poverty also contributes a lot in the problem of air quality monitoring, because the types of houses that people build, they build depending on how much they have. So we need to have houses with standards that increase ventilation so that it will reduce the indoor air pollution, especially in vulnerable communities. So to end my presentation, I would just want to summarize and say that the Dar-es-Salam city is situated in a coast, and it has the climate and the activities that expose a very high population to pollution. And we have problems of vehicle emission, and a lot of vehicles are imported through, and they come through Dar-es-Salam. We have cooking, we have pest control, which play a leading role as a source of indoor air pollution. But we don't have the mechanism to control air pollution because of the challenges that are due to lack of legal and institutional framework and resources, both human, financial, and technological. So with these few remarks, I would like to thank you very much and hope in future we'll be able to come up with solutions for air pollution in Dar-es-Salaam. Thank you very much.
Thank you very much, Dr. Ngowi. So with that, we've still a good amount of time left for some questions and answers. So I'm going to hand back to Professor Kumar, who's going to lead the Q&A section. So Prashant.
Yeah, thank you very much, Professor Miller, for chairing these sessions. And I think, as you rightly said, we have a good 15 minutes to go through question and answer. So I can see that there are a few questions already there, but I would ask actually all of our participants to put their questions if they have any on the presentations. So to start with, I think there's a question from Professor Maria de Fatima Andrade from Brazil to Professor Kao, asking about the studies you showed. Are they related to the human comfort in ambience with physical barriers like schools and offices? So I guess this is more to ask about whether they are in the real environment and where you try to put them or they are more like a the computational study where you are simulating those environments.
Should I answer now?
Yes, please. Yeah.
Oh, okay. The physical barriers, we basically we are using computational model, numerical simulation, CFD, by using software.
Mhm.
Because that's the only way you do, or you do for the yeah.
No, I think that's very powerful actually to simulate those environments which are quite complex, but especially in the COVID situation when you can't really access to many of them. But I guess the question is that how valid are those results? Are like how are they validated, or how practical or realistic they could be in the real environment?
Okay, the validation.
Yeah.
We did validation based on the existing studies. Actually, so sadly, we don't have that ventilation chamber for virus study, but we presume there's one limitation. We presume the virus is like a gas.
Mm-hmm.
So the validation is based on the CO2 distribution using CFD and experiments. So based on existing studies, and then we use the correct model to predict the virus transmission.
Okay. Did you say the virus is like a gas? Or you
for this study, so we presume it's a gas. It's a very small dimensions of particles.
Okay.
So
usually the virus size is around I think 100 to 200 nanometers, but that's not naked actually. It's always wrapped around the aerosols, like the saliva or the other kind of the things which is coming out from the human.
Also in this study because we consider the main transmission pathway is airflow. It's not by it's long distance to transmission. So that's why. Because for airflow long distance transmission is mainly because of small dimensions that we can presume the dimensions the density is similar to the gas.
Okay, yeah, that's great. Yeah, thank you. We got I think it's not a question. I think it's more of a comment from Professor Andre from Brazil again, this time for Vera, saying the excellent presentation and raising the question of women and child exposure indoors and the relation to poverty and cultural aspects. So I think this message is very important for countries which are developing. So yeah, it's just more of kind of the comment. But I think there is a question actually related to that, is that how aware are these people about the risk of indoor air pollution? For example, you showed a very nice picture of a stove in the end, and which I believe is the most inefficient cooking because it's using the biomass kind of the fuels, and even the utensils which are used are not really optimizing actually the kind of the cooking conditions inside. So so it basically, and the surrounding environment like the kitchens and all, they are either very small or they are there are no kind of ventilation conditions. So the risk is quite big when it comes to their exposure and on the health, because this is an activity happening few times in a day. So the question is how is the awareness actually, and what's going on actually in the country in this direction? Do they really see that as a kind of a problem, or it's just not really seen important enough?
Thank you for the comments about the importance of culture and poverty, especially for women and children. I think this is something that is hindering progress when it comes to looking at the health impact of the environment on women and children. But when we think of awareness, the question on awareness, I think there is awareness about the pollution and actually the impact, because there's an increase in respiratory problems for both children and women. And what efforts, what initiatives are taking place to solve this problem is that there are people who are, especially non-government organizations who are trying to develop more efficient, like cookers, using the same, like if it's charcoal, they want to use the same charcoal, but maybe use it more efficiently so that it doesn't pollute as much. So these kind of developments, I don't think they are looking at permanent solution. They are not sustainable in a way, I would say. And partly because the people who are suffering, who are in the kitchen, they don't get the opportunity of trying to come up with their own initiatives on how they propose to solve the problems that they are facing. So we need to raise awareness for women to understand that they are responsible for their own health conditions, and they are supposed to come up with solutions, not waiting for somebody to come up with a solution, either so that they can market the stoves or that kind of thing. We need women to propose solutions, and if they cannot, come up with these solutions themselves, they propose them, somebody else will help them realize them. So this is my opinion, but awareness is there, and there are some initiatives that have been taken to try and sort out the problem, but then I don't think they are the right initiatives because they cannot be sustained.
Yeah, thank you very much, Professor Dr. Vera. I think that's a very good point you made. So when you mentioned about the kind of, I think there are like number of challenges which comes from the economic, the situations, as well as the priorities. So and I believe that there are a number of NGOs working in that area as well. So I think there is a related question actually from Dr. Francis Olawale Abuludu from Nigeria. And he's asking that, are there any independent researchers working on indoor air quality in Tanzania?
Yes, there are independent researchers who are working on air quality. But then these researchers are also limited because their only source of funding, they need donors, they need to get sponsors to do these researches. So this limits on how much they can do, depending on the interest of the people who are funding these projects. But yes, we have independent researchers who are working on air pollution.
Okay, that's brilliant. Yeah, thank you very much. There is I think there is a follow-up question for you, Professor Kao, that's related to the physiological aspect of feeling comfort. So for example, when you are increasing the airflow or the ventilation in an indoor environment above a certain limits, that can make actually people feel uncomfortable. So I guess the question, if I interpret it correctly, is related to whether did you consider these the physiological the aspect while assessing the impact of these interventions in different studies?
It means discomfort of ventilation rates for human feeling.
Yeah.
So normally when we do, that's why we try to do this kind of smart ventilation. So we cannot keep increasing ventilation rates to reduce the risk. So we have to ensure the ventilation rates of for inside rooms below 0.3 meters per second. So to make people feel comfortable. That's kind of standard of built environment. Yeah, comfort. There's standard.
Yeah. So I can also see that in China, I guess it's been on the forefront of a lot of these early studies on the prevention and mitigation, and the case studies you presented, they are very relevant actually to the real world scenarios. So I'm just wondering actually how much of these kind of findings are going into the government kind of policies or the strategies, to reduce the impact of the COVID infection among the population or in the workplaces.
It means so it's actually it's kind of freelance study for the classroom. So we don't know whether we can put them into practice. But for the public buildings, because it's mainly depending on the owner. So we can do, yeah, for the last case, International Exhibition Center. So it's a newly built center. So they want to organize, host the very important conference to make people have this kind of feeling. Also the monitoring system to ensure that. So we can. So that's why they allow us to put all the ideas, the research findings into the inside the building. But for classroom, yeah, I don't know. So we have to convince the government to let us to do this. Yeah, maybe they don't. Yeah.
And what are generally the instructions actually in China for, let's say, the academic institutions or the workplaces when it comes to reducing the impact of the, or reducing the transmission of the COVID? Just for the curiosity, actually, to understand.
Sorry, I didn't get this question.
So what are the policy measures which has been put in place for the workplaces or the educational, the institutions by the government, to contain the COVID transmission in China? So what's going on? For example, in the UK, I think there are some government the guidance in terms of if you are if that's not essential, you try to work from home and try to maintain the distance, having the face mask and so on. So I was curious to understand actually what's going on in China.
I think in China, basically it's a social government. So it's kind of management system. So we are tracing. Well, our mobile phone is tracing. It's traced every day. So we have to show people we have a green pass. So we have to report to government where's our mobility pass every day to make prediction of the health situation. So if it's if you went to the risk region, so this kind of you don't have green pass, you will become to red. So you have to stay at home. So you have to take a test, stay at home, for some time. It's basically a management system.
Okay, that's brilliant. I think we are almost just 1 minute to 10, so we should possibly close this session. I would like to start, by thanking our, the chair of the first session, Professor Graham Miller, for the fantastic sharing and keeping the time, and to both our speakers. Actually, they have done a brilliant job by presenting very nice, the summary of the works and bringing the key kind of, the insights from the work they have been doing. So thank you very much, all of you, for your time and your contribution to this webinar. I think we have our next webinar on 18th of February. So as you can see the slide here, and this is on 2 to 3 p.m. on the GMT, the UK time, and we got colleagues from Egypt and Iraq. So it's basically covering the part of the Middle East region. So I welcome you all to register on the event page. They all are there. So if you have registered for the first one, then you might see actually the link for another one, but we will put it on the social media at different places. So you can see in the chat box, those links are there. And yeah, we will welcome you and we look forward to see you in the next webinar. So thank you very much again for your time and attending it. And if you wanted to have the copy of this, this webinar, then you can visit our YouTube channel and you can see them. Hopefully they will be available within a week time. Okay, thank you very much, everyone.